involve us. I want to thank you because you have involved Uganda Kingdom. When you involve Uganda Kingdom, you have involved Busoga Kingdom. But we want to see you in Busoga too, because the picture in Busoga is not very good. Purposively involve us and let us all have a uniform message that we can take to our people. You asked how can Echigango, Echoto, Akasaka in Bunyoro, Echisakati in Uganda, how can it help? Our young people, we are lucky that our young people still believe that culture is important in their lives. So if we use the cultural avenues, there are so many messages that we can take to our young people. There are many messages that we can address using the cultural structures. When we talk about issues of sexuality, normally people are scared of the word sex, not the last letters. They're just scared of the word sex. That's why they think that when you talk about sexuality, you are going to teach children how to do sex. If we come up with a message that can be properly disseminated using the cultural institutions, because it is the culture and the religious institutions that are fighting the sexuality education. If we come up with a proper message, we are able to pass on that message without necessarily fighting. Because after all, even if we think that we cannot tell our children certain things, our children in Busoga, first encounter of sex is 5 years. Yes. First encounter of sex is 5 years in Busoga. So what are we hiding? What are we hiding? For some of us who are moving during COVID, you would find a 7-year-old moving 3 villages, selling pancakes worth 7,000 shillings. And by the time she gets home, she has been sexually abused. A 7-year-old. So what is it that we are fearing to tell our children? You may be surprised. If you tell your 6-year-old and say sex, they will first laugh. If you sit down and find out why they are laughing, you'll be amazed the information they give you. You'll be amazed. So for me, I think that when it comes to HIV, we all have to participate. The schools, the parents, the people in the community. Let us have information for all levels so that we are able to pass it on to our young people. Thank you very much.
Thank you, Dr.
Yes.
And before you come in, the next whatever, there's something that is interesting.
Oh my.
I was somewhere, and a father was giving testimony. And he said his P3 child comes back from school with a question and asks, Daddy, is it true that people play sex to produce children? The father looked at the girl. P3 is how many years are those? 8 years. So he looked left, right, and center. He wanted to run away. But then he felt he had to answer the question. And then he said, oh, yes. And wanted to run away. He said, no, Daddy. Please, a moment. Daddy, does it mean that you have played sex with mommy 3 times? Because we are 3. The father didn't know what to answer, and the story ended there. But let me also clarify on the issue of sexuality. We have been consulting the religious leaders. You see, in 2018, government, through Ministry of Education, launched the sexuality education framework for the in-school. And Ministry of Gender was tasked to come up with sexuality education guidelines for the out of school, which we have been working on. We had a setback when the religious leaders, after the launch of the sexuality education framework for the in-school, said they don't agree with many of the things in the framework. So we learned our lessons. So we have tried to engage every religious denomination to give an input into the guidelines. We have had to be forced to change the name from sexuality education for the out of school to life skills and health education for the out of school. And many seem to be comfortable with that. And so we thought that to create peace, we go with life skills and health education for the out of school youth. And I want to promise you that with your support, we should be able to conclude on this document before Christmas, so that we can use this document to go out to influence the young people out of school. The in-school are easy to target. The out of school is a bit complicated, because you have to consider who are you going to use to pass on the information. We have been rightfully advised by Clara that it must be the peers. It must be the peers who will talk to these people. Again, the issue of age appropriate will also come in, because even the out of school are constituted by different ages. So which information do you give to what? Now, I've been told by my sister in Busoga that by 5 people are already active. Now, that's another thing that we have to consider. So the challenges are many, but I think we will be able to surmount them. Next question.
Yes, thank you so much. It is always highly crucial and pertinent in such events we have more youth voices. My name is Emojel Trevor, Youth Coordinator, AHF Uganda Cares, and also Mr. Y Plus 2022-2023. I remember our theme for 2022 is pass us the mic, we have got the voice. So we have got the voice, this is time for us to speak.
You have the mic now.
Yes.
You have the mic.
So some of the things I wanted to say have been married into what the speakers have shared, but I'll go into the issues that I felt have been untouched. I remember Ministry of Health mentioned that access to condoms, the last mile distribution of condoms has happened. But I want to let you know that these condoms for us young people is causing us problems with our parents at home. You get home, and your mother sees this condom, you're going to be in trouble. What am I trying to say? Our parents have not been as much empowered as the adults. And if you come, for example, as experts with solutions, you're leaving out the experts of the problems, and these are the young people. It is very important that we involve the young people right from the planning, so that young people can guide. Let's say, for example, young people want to do skits, young people want to do dance and drama, young people want to do enticing things that will spread the information. We want to use things like TikTok. How many, I've not seen a lot of Ministry of Health having messages a lot on platforms like TikTok for young people. It's important that we get into these different places where young people have more engagement so that we can target them. And then finally, I'm going to speak on behavioral change and the need for us to invest more in behavioral change. We have a section of young people that actually know these services are there. I'll give an example of a young man who knows about PEP. But this young man comes to me and tells me, you know what, I have this show in the weekend, and I know I'm going to sleep with this girl, so let me take the PEP before. And so the young man knows there is PEP. He's going to take it before because he feels he's going to be protected. So I think there is need for us to also target how we can mentor young people and can try to reverse some of these reckless behaviors that we have as young people. It is important for us to educate and empower on the reversal on these. You know, they say young people do not fear pregnancy, but they don't fear HIV, they fear pregnancy. These are things we need to reverse. I'll end here, and thank you so much.
Before you give her the mic, what's your comment about there's a new trend? When I was young, we used to talk about sugar daddies. Now there's a new trend of sugar mummies. What's your comment?
Someone who has gone through campus, I know that this is very true. I'm a graduate. Being in the campus setting, because young people need
How many sugar mummies
money.
do you have?
I do not have. But because young boys need, they will engage with the lecturers. They need marks. They need to, have some upkeep. These things are happening in school. So it is important for us to get there and
What do you
reverse.
think we can do?
What do I think we can do? let us target and get events that are youth-friendly and youth-lively. If you bring young people in a boardroom conversation like this, the uptake of this information is not going to benefit them as much.
Thank you.
But if we took them in
Dr.
an
Joyce
exciting
has
place...
proposed the edutainment as one of the ways to go. And I think, DG, I think there's a point there. Because I remember we were at campus when Indiurida was performed. There was no parking. We used to have a term called parking. The parking lot was empty for some weeks. But you know, it needs consistency. After some time, people forget. And so, even when Bongo the retire came, I remember I was at campus, and for some time we got scared. But after some days, the memory faded. And so, I know it's expensive, but I think something worth it doing because it worked on us. I also remember days where there was something on TV. It was about teenage pregnancy. There was a film from Kenya. There was a Richard there. What was the name?
Consequences.
The consequences. The consequences worked for some time. To the extent that I still remember the consequences. I'm advocating for how can we inject some money into the Ruswatas of this country. We have this man called Philip Ruswata. They do a lot of comedy. They do a lot of things. I think the man is saying that that's the language he understands. And I think that's consistent with what Clara was saying. That the language, the messaging, how are we messaging? They don't want to be listening to lectures that we are lecturing to them. You know HIV is there. No, you will die. Thank you very much. Let me have two last chance. Yes, ma'am.
Thank you very much. Flavia Chomkama is my name. And I bring the voice of women and girls living with HIV in this country. From 1995, lived with HIV, and I would testify that I have not infected any other person since that time. And I delivered one child before I knew about my HIV status, was HIV positive. He passed on in 2018. But the other two, after I had known my HIV positive, 23 and 26, and I have a grandchild. So why am I bringing this testimony? The issue of lived experiences is paramount. And HIV prevention can only happen if we are self-disclosed and we are sharing our HIV status. And we cannot share if we have not tested. I also do realize that in the year 2022, Sarah didn't talk about it. HIV transmission from mother to child increased a little bit towards 6,000. So over those years, I protected myself, delivered HIV negative children. But today, our daughters are getting HIV infected and delivering HIV positive children. We still have a lot of stigma in schools, and the fact that positives are dropping out of schools is because of the stigma, and it emanates from the fact that we have limited information on HIV across the country. So as mothers living with HIV, we are concerned. We are come up with what we call the Women at 40 campaign. We are thinking about intergenerational dialogues. For those of us who are old, we want to talk to our young daughters who are HIV positives to be retained in care, to be able to deliver their children HIV negative. But when we go to the communities, our daughters are very angry. How did you deliver me and our sons if you knew you are HIV positive? We have had to go across the country apologizing for all mothers with HIV who have delivered HIV positive children, because we want our children to be confident, to be empowered to access ARVs. And we are talking to the young people that Bali Sabuti, we lived on Mivumba of ARVs, you people, at that time in the early 90s. Those who had died in the UK, they would bring us those leftovers and we would share among ourselves. So we are telling the young positives that they should take serious caution and ensure that the ARVs are taken seriously, because we are lucky. For us it was, it was a miracle that we even got on the DAT, on a trial. We were only 6,000 that were on that trial. And we were lucky that that trial became efficable and we are able to spread it to the entire country. So intergenerational dialogue, through the drama groups we had at AIDS Information Center, the tassels of this world, they nurtured us. And let me tell you people in this room, you cannot control HIV unless you reach us. We are the only persons that you need to concentrate on so that we cease the transmission. The stigma in school, the stigma in communities, the stigma in families is a big issue that we need to come and share our testimony. We need support, shared confidentiality for disclosure, not on radio, not on TV, but that if I know I'm HIV positive, I can talk to another person.
Thank you.
Before you go, community systems. We do realize that we talked about the National Community Health Strategy. Unfortunately, their community perspective is stopping at the VHT, who is Health Center 1. But they have forgotten that we have support groups that need to be reached out to. The PDM should actually bring resources to these community groups so that women and men are empowered. They are not poor to ask for Rolex of 500 shillings to have sex. And I think the other bit is about participation and representation. We have all these governing bodies, and the young person, the apps girls need to be on these committees. You need to listen to the stories as you program, as you plan. How many of us in our institutions, in our organizations, are on these committees and are able to drive or influence the decisions that you are making? Please, in the early years, we were targets for medication, for programs, but now we are able to speak and drive this agenda. And UNAIDS is saying 30% investment. How many community groups are receiving this investment, particularly those of HIV positive or affected families? How many community groups are actually receiving those grants and implementing the activities? Whenever grants come, we have relatives, the LCs, and to whom it may concern, those who know the people receiving the grants. And the more people are not reached with these resources, the more we see infection increasing. Finally, the law that criminalizes HIV transmission. It's a big problem to us because we are worried if we share our HIV status. And we saw the Namubiru case, how she was humiliated, and she has since deceased. Is it possible for us to work with you parliamentarians as you revise the laws, that we look at those laws that favor access to services? And punishment works for a few people, but I know the carrot works better for particularly women and girls living with HIV in this country. If you reach out to us with the right information, or you give us even the messages, support us to reach the schools, support us to reach the communities, we shall be able to tell the story, and many people will understand that HIV isn't simple, that taking medication is not easy, that delivering HIV positive children is very difficult, that we can change the tide, and we are the game changers in all this.
Thank you very much, madam.
Thank you, sir.
Intergenerational dialogue,
Yes.
participation.
Yes.
Can you give the mic to the younger man next to you, who is the chairman of the National Youth Council of Uganda, Mr. Jacobo
I'm privileged
Eyero.
to be near him.
That's the president of the youth.
Thank
Your
you.
take on the discussion.
Thank you, Commissioner. I think I prepared to listen more because I really love these spaces. There are very few places with the stigma around where people are bold about their HIV status, and we learn from that boldness. And so I would have really loved to listen a lot. But I've benefited from listening to Dr. Ayume here. Every time we are having same room for health discussions, I also prefer to listen because he's a doctor and he's a bit passionate about some of these challenges we have. I'll just make one comment. I think if we are racing towards 2030, the only indicator that we are racing towards 2030 is that we have a deadline. But if you check all the indicators in Uganda about effort that we've been making towards the fight, it's all going down. Even if the resource basket is going down, I think we can organize better internally to give that push towards the race so that people can actually know that there is a deadline that we're trying to beat. I don't quite understand it yet. I don't know why we still allow certain kinds of music. And someone said it, but I began thinking about all the songs that I know that don't make sense in this fight we are on. There are so many songs. Some people say, I'm going to eat sumbusa. So many songs that we have allowed from top artists. But in the past, what accelerated our effort were songs by artists coming together to sing a song against HIV spreading and so on. And I think we can still make that effort. For me, the commitment I can make is that as a National Youth Council, we look into our resources to see if we can fund a project for artists to do a song in positive light on the fight, just for the race. That done, we need to look at what we can do with religious institutions. The other day, I attended a similar dialogue, but for Interreligious Council. And I told them about the impact religious institutions has on schools that they are not utilizing. Over 60% of all our primary schools are religious and faith-based schools. Over 40% of secondary, where there is a lot more of adolescent health and change, are faith-based schools. So I said, rather than me learning, everyone must play a part. And I'm grateful that we have considered the change of the name, because that was the only thing religious leaders really had an issue with. Why are you calling it sexuality education? So if we're saying, okay, life skills and health, then that should get off the table and people get boots on the ground. We need to look at innovative ways in which school leaderships can maintain the fire. I was in over 4 clubs in the same high school that were dealing with the same issues around adolescent health. We had World Starts With Me Club, Straight Talk Club, Abstinence Club. Even Abstinence had a club. And these are things that played a big role when you look back in how the fight progressed. Today, the same group that was driving the change of the country and the numbers going down is now the one accelerating the numbers, the young people. So I think we need to create new noise, and that's where I want to see how we can go, because that's where the drum needs to sound. Where is the noise for stigma? Where is the noise for healthy living among young people? And everyone that has a following must be called to order if they are not giving the right noise. And that's where we're going to start from. Thank you.
Thank you. Jacobo, before you give away the mic, the Commissioner for Equity and Rights told us this morning that he abstained up to year 2 at the university. With all those clubs around you, you abstained up to when? Maybe you can have a discussion about
I actually have an answer. The Commissioner almost reached my level, because me, I abstained all through until I finished the university. And that background played a big part, because I remember in P4, we signed a card of True Love Waits. It was an initiative by the First Lady. And I remember signing that card in Chitante. So all through my struggles, that card haunted me. Even when you would find a very beautiful, and you know these ladies of nowadays, I think the food has become better. It is very hard, and at university it's even harder. But those commitments you made, those impacts that advocacy did, and those engagements, those things haunt the young people and stay with them. And so that delays the transition into active sexual living, and then it further delays the transmission rate.
Thank you. Thank you. Honorable Jacobo Eyeru, he's just newly married, so he abstained for until now. From chair, then I get to Reverend. They talked about religious leaders, but let me hear from Honorable.
Actually, my issue is going to Reverend. I'm glad that you're getting to him. They came up with an initiative where they had a letter from the Interreligious Council. And that letter was supposed to be read on Sundays in churches, and then Saturdays, Seventh-day Adventists, then Fridays in mosques. What happened to that letter? Yeah.
Reverend, you are now on the spot. Let's hear the Reverend, then I'll have one last one. The Reverend's hand has been up for so long. Help us with that mic. Thank you.
Let me stand for that matter.
Yeah, and this has been said severally, that if we can utilize your space, because you have service Sunday, service on Saturday, you have service on Friday, also every day, lunch hour, then we can be more effective by utilizing you.
Thank you, my elder brother Mondo Chateka. One, I'm proud to associate with the Ministry of Gender because I've grown up in this country under the auspice of the National Youth Council. And we have seen the days that my brother was talking about some 16 years ago. And we are called by God to go and serve him in other spaces that give us a chance to speak to a wider community. One, I will start with what Honorable asked about the letter from Interreligious Council of Uganda. As you are aware, the Archbishop Samuel Stephen Kazimba is the president of IRCU, and this communique was made, which was read in all parishes in the entire province, and we believe that the same letter that was written, because it is signed by the Christian religious leaders and the Islamic religious leaders, it was also circulated in all mosques and other churches that are of born-again Christian fraternities. Unless a local leader is just adamant, but when the Archbishop sends a message, it's very important for every leader to read it. I will speak about what has been on the table, which is a real concern in this country. Our Archbishop always tells us that behind the issues, there are real issues. And behind this HIV spread, we believe there are so many things that are happening behind the curtains that we must deal with if we are to bring the HIV infections to zero. Because we see a lot of moral decadence in the society. I'll start with the marriage. From the church's perspective, we see a lot of divorce happening. We see a lot of single mothers, single motherhood increasing. But remember, even when I'm a clergy, I'm a social scientist, so I'll speak from a scientific point of view, but also on a social perspective. This body that somebody makes a choice on its behalf to make it single desires to be satisfied in life. And therefore, when it cannot find what satisfies it, then it must encroach on somebody's life. I hope you have understood me. And now, the numbers as they increase and the stresses that are increasing, it surrounds the economic survival in this country. Do men have the money to satisfy the needs in the households? As women are empowered to have their own employment, she feels comfortable and takes over another apartment, and she will feel comfortable to grab a university student and take him on for satisfaction. And by the end of 3 years, you'll find things in a mess, because this student cannot control, I wanted to use our colleagues in parliament, but cannot control this woman from associating with my brother Mondo. Let me use Mondo. You understand what I'm saying? So that increases the spread. We need to deal with behavior change. Our sister Sarah, is it Sarah Naku, spoke about where do we find the school dropouts. She spoke about house managers.
shamba boys, market vendors, sell food. We were speaking about it yesterday, the increasing numbers of spas. Massage is everywhere. What is happening in massage? And we were asking ourselves during the olden days, what used to happen? Were people being massaged? What has changed our bodies that we need to be massaged every week? It's a question that we must answer as social scientists, bar attendants, and saunas, streets, name it. I happen to lead an HIV/AIDS prevention project for 6 years in my diocese, and we were dealing with youth out of school. I remember us calling them night angels, and would look, as the church would look for people to go and tap them into the bars and speak to their groups. It was a group sanctioned by the bishop. Go and bring these youth back to life. And we have testimonies of those that are already married and they are HIV negative, but whenever I meet them, they say, you are the one who caused me to get married. So we need to strategize and work with religious institutions. Gone are the days when we are only the preachers of the gospel. We have technical teams now. We have planners, we have strategists, we deal with strategic plans. We have an audience that listens to us every Sunday, every lunch hour, every time that we need to call them. And when government wants to meet them, you must be sure that they will demand kitu kidogo from you. But for us, when we drum, they will come and see what has happened to the priest and actually give us. But the most important thing is that utilize our spaces. Work with us. Let the drumming message that was there during the time of Philebongo Lutaya come back. And this is a request to government, since you are represented here, the members of parliament. The president has been speaking about COVID-19. He spends 2-3 hours narrating to us what is happening with COVID-19. Could you please call him back and speak about HIV every month, every quarter, because he was behind it and we reduced the spread, but when he kept quiet, all systems have kept quiet. I would like to stop there. Thank you very much.
Thank you very much. One from Eunice, from KCCA. Since we are in your space, we want you to say something. We don't want you to chase us out of KCCA. Can you make a comment or two?
Yes, it's not actually just chasing you out. I thought the urban voice needed to come out now that I'm not at the ministry. I know Ministry of Gender did a research sometime and got messages. There were pronouncements by the cultural leaders. Oh, my leader is out. But I know there were those very beautiful, and Madame Sarah Naku knows. There were pronouncements, there were policy briefs on HIV, on maternal ill health, and family planning. Ministry of Gender, I hope you remember and you can retrieve those and use them to drum about the prevention of HIV/AIDS. Inequalities in the city. Thank you so much for the data that was shared here. HIV may not go when we continue to say the urban is better than the rural. What is happening in our urban? People are selling their land in the rural and they are coming to town. They are doing border trade. They are coming here as house helps. They are coming here as shamba boys. After 3-4 months, they are out of their master's homes. Where do they go? They don't actually go to the streets like we have seen. They go to bars. Others go to the ghetto. I was telling my sister, Sarah, to have a day and we go to Chisenyi so that we can hear stories from those girls. A 16-year-old already has 2 children. And where does she sleep? In a shack. And how does she get the children? From the Kawenja. By the time she has 2 children, it means she's just sleeping with men unprotected. We have a Masuro. I think it was today. I heard on radio that some men are paying 1 million shillings to pay for Chimasuro. And where is it? In the city. I request for a strategy, intentional strategy, to tackle issues of the urban. The rural are poor, yes. I was asking my colleague that, did you grow up in a very powerful home? She said no. And in that humble home, did you choose to go sleeping around with people? She said no. What are the issues? We have under NDP 3 empowering youths. My friend, the chairperson, is out. But we have something to do with youth champions. And as I sat here, now that I'm at this side of implementation, I hear we are the ones who are able to make it. We are the ones who are able to make it. I think all of us have a role to play. So I was requesting you, Minister of Gender, working with Uganda AIDS Commission, can we institute a committee comprised of all these, the cultural institution, local government, youth council, the champions they've talked under NDP 3, up to the village level, like we have a child well-being committee to tackle issues of HIV. Therefore, I recommend a holistic approach to the fight. I know our chairperson here said, what is the last push? The last push should begin from an individual. Empower this individual and give the right messages like the youth has said. Hit the nail from the top, not just, malingering around and saying HIV, this and this and the other. Give the right messages, direct. That is one. Empower the family. Our leaders, why do we say household? What is a household? When I go to Chisenyi, who is in that household? Empower the family. And then empowered families make empowered communities. Thank you so much.
Thank you. Thank you.
Yes, Commissioner, thank you so much for the opportunity. My name is Mayanja Peter. I'm a probation officer, Machinde. I handle the young people. And some of the young people we have are the street children you're seeing, the young girls, children on the streets, the 14-year-olds, 15, 16, 17. And when they leave the streets, they go to Katwe. 90% of those children you're seeing on the streets are in Katwe. The children you're seeing them holding, some of them belong to them, and some don't belong to them. So, in the communities, they are sexually abused. In Katwe alone, Machinde, we receive close to 3 cases per week of defilement. And this is just a tip of the iceberg. So, to Uganda Cares, to Ministry of Health, to honorable MPs that are here, there is a time bomb. As you're driving through the streets, I'm sure you're seeing these children. And when you're with your children, they ask you, Mommy, Daddy, what of these ones? And as these children are knocking on the windows of your cars, give us something. And when you refuse, they abuse you. If the window is down, they'll even slap you. Or they'll go and scratch your car. So as cases here, we are continuing to remove them from the streets. But it's not enough. Why we are ending HIV among young people. HIV/AIDS among young people by 2030. And we have a time bomb in Chisenyi, where when the girls leave the streets, they go and they're sexually abused. On Fridays and Sundays and Saturdays, where there is a lot of drinking, there is a lot of abuse for our young girls. And to the honorable MPs who are here, and also to all of us as stakeholders, we all know that prostitution and having brothels, and of course, my manager has also spoken about nude shows, Bimansuro. All these are illegal. But the rate at which these things are happening, it is as if these things are illegal. We are legalized. The rate at which prostitution is happening, the rate at which brothels are coming up. I believe, honorable members, you have homes within Kampala, or you stay around, much as you represent other jurisdictions.
Mayanja,
Yes.
can you specifically speak to the ordinance? Can the audience here get to know about the ordinance? You are saying removing the street children is not enough. And of course, we have been removing them and they come back.
Yes.
Can you tell them the strategy that we are adopting? But also, may everybody know that streets don't produce children.
Yes.
We need to address the push factors, but also the pull factors. But talk to the ordinance so that my people here don't fall victims of the ordinance.
Yes, as KCCA, we came up with a Kampala Child Protection Ordinance 2022. Specifically, this law ensures that we don't give handouts to our children, because we know it is because of the handouts that these children prevail on the streets. So it is a law we are implementing, and we don't want any one of you to fall victim. So that is something I've said about the ordinance.
Thank you very much.
Yeah,
so
but as I leave the platform,
it's criminal. It's not allowed for you to give money,
yes,
or to give food, or to
yes,
give anything to children on the streets, because that's one of the pull factors. If these children were on the streets for a week and nobody is giving them anything, they will walk away. But the fact that you continue to give them handouts, they will remain on the streets. So we need to be all responsible. We are not being callous, but I think at certain points in time, you have to do the right thing.
yes. So, Commissioner, as I leave the floor, let us all please interest ourselves in the community of Katwe. It is a time bomb. Katwe and Chisenyi, but specifically Katwe, because 90% of the children we're seeing on the streets are coming from Katwe. It is a time bomb. When you go there, it is another country in Uganda. They drink from 7 a.m. to 7 a.m. the following day. Thank you.
Thank you very much, Mayanja. You was pushing me to the other topic where we need to talk about family planning. Because you see, if you have produced 2 children, there is no way you can leave one of them to go to the street. But because people are producing in excess, they have excess baggage. So when 1 or 2 disappear, they don't even care. And you ask them, and Reverend is still here, they always quote the Bible. That the Bible says, in a verse I have forgotten, that go multiply and fill the earth. Who tells them that they were indicating that you, Mujuni, alone, you are going to fill the world? Why produce 20 if you can only afford 1? Because I've been telling them that even God himself produced only 1 son. Of course, we all pretend to say we are all sons of God. Maybe we are stepsons. But the Bible says his only begotten son, Jesus Christ. And Jesus Christ didn't produce any child. And it was not criminal. So if people continue producing the way they are producing, we shall continue getting the problems that Mayanja is talking about. Let's keep talking about this, especially members of parliament. I know you want so many people so that you can have votes, but many of these, if they are uneducated, if they are not looked after well, they are the ones who spoil the votes. They are the ones who tick wrongly. Now, I want to come away from there, get back here, and I'm going to ask you for parting shots. Parting shots from each of the panelists. and then we shall go into the closing of this meeting. Can I start with Henry? Your parting shots. You have 1 minute each. Time. Yes.
Thank you so much, Commissioner, for stimulating a lively discussion. I would say that as an organization, we are excited to hear that what would have been caused a fear about discussing and disseminating, sexuality education was the name. But now with life skills and health education, it's getting acceptable, which means that disseminating, the life sustaining information about our young people, about their growth and managing their growth is now in the right direction. So I want to thank the efforts and the progress that the religious leaders are making with means of gender. I also heard about the Uganda government, Uganda kingdom, the structures and even that age-appropriate, education. And I think that we need to integrate it with what we have in the life skills and health education if we are to have, comprehensive, dissemination. Critical is the issue of resources to ensure that, our interventions about life skills and health education are implemented. But I think as a country, we need to think about what's the social implication, socioeconomic, implication if we don't invest in life skills, health education. And we could also look at what are the returns if we invest in it. And therefore, we need to mobilize resources. Resources can include money, but also can include, human resource. You talked about the peer. So it's not only about money that will help us drive the life skills and health education. Thank you.
Thank you, moderator, and thank you, colleagues, for a very stimulating debate and conversation. I think the focus on youth is critical. At Uganda AIDS Commission, we've segmented stakeholders into what we call self-coordinating entities. 12 of them, including government, parliament. The youth have recently approached us and said, you've mixed us up, and we would like to be an independent category of stakeholders. We commissioned a special study, and we've agreed with them. And we are going to set up an entity dedicated to young people. We still need to go into defining young people because it's not enough even to say out of school. Because within out of school, there are subcategories, there is the literacy level, and that helps in trying to see the best way to reach them. But because of some of the issues that arose, I thought I should just share, especially because our leaders from Parliament are here. The Commission has been very purposed around how to approach different categories, including the appointments at the board level. The board is appointed by the president, but if you look at the categories, all the segmented population categories are represented. There's a young person on the board representing the youth. There's a religious leader. I don't know, I think you said there was a Secretary General of the Uganda Muslim Supreme Council. The current youth religious representative on the Uganda AIDS Commission board is actually the outgoing Secretary General. So if issues are not getting back to IRCU, it's not for lack of representation, it's a different problem. Cultural institutions are represented. The former Prime Minister of the Lango Cultural Kingdom is there. Academia is represented. So, and the president, somebody asked the challenge about the president. The president hasn't kept quiet. I follow every single speech by the president. And all the last national addresses, HID was. I think at level and higher, it's not for luck. If you listen to the Honorable Chair of the Health Committee and HIV Committee, they are at this on every single day. I think what we need to do is to marshal the rest of the forces. Let's charge. Leadership is not just about position. Everyone is a leader. A single mother is a leader. What she does, her children are watching. A youth in school is a leader. Wear that uniform, be exemplary. Because those people out of school are watching you. And if each of us see ourselves as leaders, as responsibility for having responsibility for role modeling, as mobilizing others, then we will go a long way in creating change that we are looking for. Thank you.
Thank you very much, moderator. I just first want to clarify one question. I don't know whether it was a comment. Just to say that PEP is the post-exposure prophylaxis, and the PrEP is pre-exposure prophylaxis. So PrEP is what you take before you have a sexual encounter, and the PEP is what you take after. Yeah. Yes, so I think yeah, so the categories of people who take PEP are those who have been sexually abused, probably, and they come to the facility within 72 hours, then they get PEP. But those who are vulnerable to HIV infection for many other reasons could, when they come to the health facility, would be health educated and guided on how they can take PrEP, including young people who are above 18 years and emancipated minors. So thank you very much for the lively discussion that we've had. I'd like just to say that Ministry of Health, looking at the discussion that we have just had, is that moving forward, we suggest that we provide services which are person-centered, because the vulnerabilities are really many. So we need to be conversant about the different vulnerabilities that adolescents and young people have. And if we have to do that, then we have to provide differentiated services as we think about even the guidelines that we want to roll out and to finalize. But also that we talked about integration, to make sure that the outreach programs that we have at community level are really integrated with health services. But to also emphasize that as we continue with the YLP programs, the women empowerment programs, that those programs should actually be integrated with HIV prevention, care and treatment messages, and also sexual reproductive health messages in them. Because evidence has showed that one young person who is vulnerable needs social services. They need education services. They need health services. They need norms change at community level. Just one young person. So that's why we are saying that we need to provide integrated services to that young person at community level. And then specifically also, just as I wind up, moderator, to talk about adolescent responsive services. Recently, based on found out that we don't have to pin the adolescent sexual reproductive health services only to a building, but to make sure that the health facility is adolescent responsive. The health worker is adolescent responsive. The peer at facility is adolescent responsive. And then the peer at community as well is adolescent responsive. So that makes it much more easier to reach out to all the young people at facility and in community. And as I wind up, we also need to, just looking at the discussion with the different stakeholders around, that we need to build very strong synergies of referral and linkage of services from the different line ministries as such that the young people can receive comprehensive services. So as we provide services at community level, we need a very strong linkage and referral and linkage to the facility. And also promoting, helping those who are at community level to also access school, just in case they really need to go back to school. Thank you very much.
Thank you, moderator. Thank you, audience, for your kind feedback and the comments. And I want to make a commitment that those ones that were directed to Minister of Gender, it's good that the moderator is a commissioner. We promise to take them on and we say we can address. However, I think most of comments that have come out, but today's conversation, there were issues that were rotating around the drivers, the triggers. And of course, I want to promise you these were identified in Objective 5 of Human Capital Development of reducing gender inequalities and all vulnerabilities in community, in using the life cycle model. And this calls for that at each stage when the child is born, there are facilities and care that we are supposed to provide as a country for us to marshal this person as a human resource that this country requires for us to pursue our Agenda 2030, Vision 2040. And I think for me that is key, because most of what has actually come out, if you are not addressing issues of poverty, empowering communities economically, providing information as empowerment avenue, then you are saying you are providing a room for these vulnerabilities and violences to continue. So I want to implore upon you that the struggle is on at every stage, every stakeholder, and the promise that we can make as Minister of Gender beyond the framework that we are saying addressing sexuality education out of school, which you have rebranded to call it life skills and health education. We need to ensure that the coordination mechanism of those social issues that have been pointed out, social norm change, bringing on board cultural leaders, religious leaders, and other stakeholders to be a central role that the Ministry of Gender will take on for us to give accountability on each responsibility center on what we have done. I want to thank you, the conveners of the meeting.
Thank you very much, Haji. Clara, in 1 minute.
So I'll borrow the lesson that we learned across the HIV journey, that triumph to find treatment. And I think it's also the model that the SRH Alliance uses to enable the communities and the general public to embrace the response and to be accountable and to be intentional to lead in really ending the HIV new infections among the young people that we work with, but also engaging more collectively with the overall stakeholders at the community level and all levels to take charge on that. So 2 takeaway points from me would be, 1, we need to go back and learn from the lessons on how we can effectively engage communities and allow them to take lead in addressing most of these challenges. And then 2nd, which is of course very important, and it's at the heart of the HIV response, good governance, transparency, and accountability. We have all the money, but we've not been intentional on making our money work. So a key action for all of us, how can we invest in the right places, track, and make sure that the monies are working for us? I'd want to end by highlighting that the data is speaking, and communities are also giving their lived experiences
These are realities, these are facts, so we need to listen and be intentional on acting. Thank you.
Thank you. Sarah, your parting shots.
I think mine is want to appreciate the discussion. I will not speak much to what we are supposed to do because my colleagues have spoken to that. Information was one of that was on that kept coming in, and I said, okay. I think a lot is still desired in prevention, but I know we are climbing this hill of hope together as a team, and we want to harvest the fruit of hope, which is on top of that hill. We have climbed up to the middle of the hill. We are remaining with very few steps to reach that hill. Get the fruit of hope, and then we clap and say all is over, so that we plant other trees that we could harvest later in other health-related areas. Let us not give up. Let's keep the hope high, and let us work together. It requires working together as a team without discrimination, without stigmatization, and we'll be there. And Uganda will be on top of that hope of hill by 2030.
Thank you. Thank you so much. Everybody, can you clap for the panel? The rest will get away from the high table, save DG and Henry. Henry, you'll come and take the seat of Haji. And can I now invite our chief guest as we move towards the closure, Dr. Ayume. Can you come and take the middle seat? You are kindly going to close for us this conversation. DG has to run for another meeting, but we are going to be extremely fast in closing this meeting. Can I invite my friend Marima to come and give us 10 points that you have put down as a takeaway from this meeting? And then the closure will take place. Don't mind if they are 20. When we came into power, we came with a 10-point program. We kept on making it bigger. So, Marima, you have the floor. You can press the button there.
Thank you, colleagues. The National Dialogue on Life Skills and Health Education for Out-of-School Youth and its implications to achievement of the national strategy to end HIV/AIDS in Uganda. The theme being achieving zero new HIV infection among youth in Uganda. I managed to pick a few highlights, though there are many. So one of the highlights of the key recommendations was that we need to reach all youth at all costs with the right information about HIV and AIDS. We also, the participants talked about inviting at least one of the school adolescents to come and give an experience they go through in regard to HIV and AIDS. Somebody also talked about advocacy as one of the initiatives to fight this. We also said communities are key if we are to end HIV, AIDS by 2030. Somebody talked about the dangerous spots where these things take place, and these include hotels, banks, homes, among others. So we need to take serious steps by getting interested in these areas. We also said inclusion has to be intentional on a holistic approach without leaving those who have the virus. So we need to recognize the community by involving them through use of models, among others. In villages, we have those upcoming singers We have other models where these children, adolescents, can help us pass the message. Somebody talked about medical interventions. These are existing processes like providing PEP, circumcision, condom use, among others. Another recommendation was a multi-sectoral stakeholder approach should be used. Here we are talking about cultural leaders, religious leaders. We also have the adolescent empowerment programs like YLP, WEP, and others. So we need to use that multi-sectoral approach to get rid of this pandemic. The little resources that is available need to be concentrated more on the economic ventures other than the direct approach. So we also have to look at it from that approach. As Parliament, the parliamentarians looked at it as, because it is the legislative body, they need to give the final push to the pandemic. How do they do this? By amending the existing laws so that they fit into fighting the disease. He talked about the fear report that was released last year, and he said there is need for it to be presented to Parliament. We should also organize for the members to internalize it and know the indicators about it. The community solution on this, somebody observed that PDM is the child on the block. So all those interventions should be tailored to PDM so that the big man can give you an ear. Finally, our religious leader observed that we need to use the existing structures in the religious, cultural, and other government structures to push the message down to the people. I want to thank you for this. Thank you very much.
Thank you very much. That's a snapshot of what has transpired here. And ladies and gentlemen, we are coming to the end of this meeting. We have talked about a number of things, and we are saying we must do. And that reminded me of what J.F. Kennedy would have said if he was here. He said, things don't happen. Things are made to happen. So whatever we have said that has to happen, it's we to make the things happen. Then another author said, if not me, then who? If not now, then when? I think the issue is time to act is now. Moving away from the book of Lamentations to the book of Acts, we need to act now if we have to go and change the face of HIV/AIDS in this country. Having said that, I must say I've enjoyed moderating this meeting, and thank you so much for making my work easy. I've worked myself out of the job. Let me invite Henry to make one or two remarks. Then you invite the DG, and the DG will invite the chief guest to close this meeting. Thank you very much. I sign out.
Thank you so much, Moderator, Commissioner Mondo, and for giving this ambush. But all the same, to say that as HF, we are saying that the lives of young people matter, and therefore issues that affect their proper growth are critical to our heart. And therefore, as an organization, we will continue to work with all MDS to ensure that together, as everybody has said, we reduce the HIV infection and help our children to make, the right choices regarding their career. We have interacted with many of them. They fell out of school. Others have been denied the opportunity, to get education. But with life skills, health education, they're empowered to make the right decision. One of them told me that I think I acted stupid. But if you had had this information, about their life, how they can manage their sexuality, they would not have, be living in life of, regret. But however, as an organization, we continue to, nurture them, counsel them, and we have had a great team coming out even to counsel others. So I want to thank everybody. I want to thank Minister of Gender again for convening all of us, and thank everybody who has stand up here. That demonstrates that the life of our children, our future actually depends on our children, our young people, and you prioritize it in all your areas of service. So I don't want to take a lot of time, but to thank AHF, Uganda Cares team, also for working with the ministry to ensure that this forum takes place. And I think I think we should always have one like this. We should always be able to get together, reflect, and see how we have moved. Quite a lot of progress, as I mentioned. Just leaders coming on board, the Minister of Gender, to begin to agree on content on what should be, passed on to young people is a very great, progress. And also, the cultural leaders. Certainly, you have mentioned that you already have, the education that you are, passing on, and it could be rich, and really it's rich. So the issue is, how do we integrate? How do we ensure that we give out, the same package? So I think the dialogue should continue. So without taking a lot of time, I want to invite the DG to make remarks and invite our chief guest. Thank you.
Thank you very much. One is to appreciate the Ministry of Gender for organizing this, and AHF for supporting this very rich dialogue. But as I was reflecting through the conversations, but also given what the Honorable Chair of the Health Committee, one of the tasks he put out to us as Uganda East Commission is to present the UFIA report to Parliament. When you think through the UFIA report, one of the disparities it shows clearly the differences from geographical location. If you look at the Karamoja region, for instance, it has the lowest HIV prevalence in Uganda. One of the districts there, Nabiratuk, has a prevalence, an HIV prevalence of less than 1%. If you look at now, Karamoja, typically we look at it as, a region with high GBV. There is what we call, in our language, for us, the gender experts, courtship rape. But Karamoja has the lowest HIV prevalence. So as we look at interventions, what is it that makes Karamoja as a region to have low prevalence for HIV? Look at the West Nile region. It has had an invasion of refugees from the neighboring countries. When you're displaced and you're in that kind of community, typically HIV prevalence goes high, but it has maintained a low prevalence. And when you talk to leaders from that region, they will tell you things that point to behavior. So as we go for the last mile, we've had colleagues, within the Ministry of Education, we've been trying to revive the AB, especially the A, because in school you can't talk about even B. You're talking about the A. But listening to two colleagues talk about their experience when they broke the first virginity, I will go back with my team and we, say, because we are looking at all options. When you're heading for the last mile, options. And maybe if we hear more of these testimonies, because typically when you talk about virginity, people frown on it as outdated, as something not. So we will borrow on all experiences as we face the last mile. But my role here is to invite you, Chief Guest. First, appreciate you for your commitment and leadership. You're sitting through this today is partly a demonstration of that. I'd like to appreciate you for that and invite you to speak to us and close this session. Over to you, Honorable Dr. Ayuri.
Thank you very much, DG.
distinguished ladies and gentlemen in your various capacities. Once again, my name is Dr. Charles Sayume. I'm the Member of Parliament, Koboko Municipality, and I chair the Parliamentary Committee on Health. It's always an honor to be here and speak to different people from different backgrounds. And when I became chairperson of the Health Committee, one thing I said, actually when I became a public figure, serving in a public office, one of the things paid for by taxpayers' money, one of the things I said is I'll try and make myself available and accessible. And there are so many people who are gobsmacked that I only have one line, one phone. And I'm sure the DJ has three lines. I have one line, and it never goes off, maybe a network or the battery, or maybe if opponents are bewitching the my phone and jamming the network, but I try and make it as accessible as possible. So that, civil society, that person in Nabilatuk, in Kabong, in Kisoro, I get phone calls of people with all sorts of problems. Some UPDF saying in Somalia we have not been paid for 18 months, yet we are back. I don't know why they are calling the chairperson of the Health Committee. But of course, those are the frustrations of people at all levels. And sometimes you ask yourself, has our system failed? Why would a teacher be calling me, telling me, in Kanungu they have not had salaries for 6 months? For us, and I think it really shows that we have to work harder. Now, on the side of Parliament, much as resources keep on shrinking, we still need to be a bit frugal with the little resources that we have, because we are all aware that we have donor fatigue setting in. Most of our budgets for malaria, TB, and HIV are hinged on the good premises of donors, and that has been there for the last 20 years. PEPFAR is, I think, one of the best foreign policies by the United States government. It has helped us, it has given people hope, it has given government hopes, and at least I'm sure that every one of us here, either directly or indirectly, we have been touched by PEPFAR funding for the last 20 years. I said earlier on that I've been fortunate to live during the transition of when HIV/AIDS was like witchcraft. We were, I say, gambling, and I think the first actually ARVs were emanated from anti-cancer drugs. So they would indiscriminately pound the body. You know, people would get jaundice, the liver is hit, the pancreas is hit, and so forth. And of course, with a lot of groundbreaking research, and I'm saying research, Uganda has housed a lot of groundbreaking research in the world, and I think that deserves a hand clap. Incidentally, the research takes place here, but publishing is in Washington State University or Harvard. And again, that's a challenge. But a lot of groundbreaking research has gone here. So we shall go down in the history of HIV/AIDS management in saying that we have managed to get some solutions. We are not yet there. But I think the end is quite near. For those of you who lived in the venereal diseases, recently we were able to scrap off from our statute books in Parliament the Venereal Diseases Act of 1973. When the likes of the Kabotongo, syphilis, gonorrhea were big things. And I think I remember General Idi Amin decreed at one point. It was really mopping up so many communities. But we got a solution with the advent of antibiotics and so forth. It's no longer a public health threat. So I also think with HIV/AIDS, with a concerted effort, good enough there is political will from the head of state going down to all levels, including Parliament. You can see we have a committee that is
a standalone committee outside the HIV/AIDS outside the health committee. We have one specifically dedicated to HIV/AIDS. So that's the seriousness. I spoke about 50 billion being set aside. That was the only enhancement. I think there were two, 50 billion and 20 billion. Government has deliberately put 50 billion, showed donors that there's a lot of commitment. We go back to the drivers, and I'm still not convinced about what are the drivers. I, for one, think communication, advancement in communication. I'm yet to do a study with School of Public Health, but if there are funders here who can fund my study, the more we get, our communication gets advanced. That means I am able to see a good picture of a lady in Barara and make contact with her. Yet before that was not there. I was only limited to my geographical locus. But now with Facebook, with Snapchat and so forth, you know, people disturb your wife, you also disturb somebody else's wife, and so forth. So could we also say advancement in communication? It used to take me 4 days to travel from Koboko to Mbarara. But now, with a better road and all these things, it can take me hours. If the lady says, please come to Ginger, in the blink of an eye, I'm in Ginger in 2 hours' time. So we need to also explore that. The border industry. You know, one border sleeping around with so many people. So can we localize our strategies? The DG pointed out that the difference prevalence. So can we strategize? Can we make our strategies speak to these geographical areas? Karamoja, and one time I was talking to the MPs from Karamoja, and it says it's a taboo to look at, is it a married lady? They have their own social norms, they have their own cultures, and I think much as GBV will be on the high, but you cannot look at a married woman. That is taboo. While in some other places, it's the norm. So let us tailor-make our interventions to suit the different prevalence geographically. As a chairperson, I pledge that the Committee of HIV/AIDS and the Committee of Health will be readily available to listen in. We have an open door policy, and we're trying to bring Parliament to the people. Sometimes when we invite you people to Parliament, you think it is either the Mabati scandal or you're in some form of trouble. You know, I'm telling the DG, he wants to meet her. I'm telling him, no, you can come to Parliament. He's like, no. Can we meet outside Parliament at his own cost? Parliament is not always for trouble. Please come in, state your case. We're there to make laws, and we're there to push the agenda for some of the policies where we are stuck. Otherwise, I thank you very much for giving me this opportunity to close this meeting and to be a shotgun guest of honor. I only got to know as a guest of honor a few minutes ago. But thank you very much. I would like to declare this meeting closed. Thank you.
Let's have a quick graph. You can descend, and the rest of us can stand behind and on the sides. Then we shall do prayer. Okay. The command of religion says we pray, then the photo takes place. Please, you have it. You can start moving as we start the prayer.
Thank you, Lord, for this gathering this afternoon. We thank you for the deliberations that have been made. Thank you, and everyone that converged in this place to discuss and understand and analyze the situations that your creation is going through. We pray, O God, for our country, Uganda, that you bless it, and as we plan to shoot the last bullet on the fight of HIV and AIDS. God, give us the energy, enable this country to get resources that are required, enable every stakeholder who has a heart and passion to do this. We pray that God, as we move out, you'll move with us in our different spaces of service. Bless us in all things that we need. Listen to our heartly desires when we cry unto you. And bless everything that we shall do and our lunch. I pray through your Son, Jesus Christ, our Lord. And may the blessing of God Almighty, the Father, the Son, and the Holy Spirit be upon each and every person. Bless our guest of honor, Honorable Dr. Charles. Bless every person, the DG, Uganda AIDS Commission, and every person present here from now and forever. Amen.
Lunch is going to be served. The coupons are here. But also, people will sign for something small to take you back home. Those of you who feel must sign for something. It's not compulsory. Thank you very much. Photographer.
So where do we go? Here and up.
Commissioner?
People should hurry.
And in this meeting, 13 African countries have been online. Uganda, Kenya, Rwanda, Nigeria, Sierra Leone, South Africa, Lesotho, Mozambique, and Eswatini. They have been with us in this discussion. Let's clap for ourselves. Thank you very much. May you go in peace, like the Reverend said. Thank you so much for being with us. God bless you. Are you ready?
Colleagues, our lunch is being served in Paradise Restaurant. Paradise.